The information I'm going to share with you is something that I started doing a long time ago, because what I found out is that when someone's in pain, they're very highly motivated to keep their visit and do their home care. But as soon as the pain goes away, what happens? We just forget about it. We really don't know that there's a difference between the pain and the problem, right? So in the spine, you can get a problem in your spine, the spine's not functioning properly, and then you get pain after a while. And then when you start treating it, the pain will go away first, but the pain, most people, the pain goes away with like in a month's time. Probably 9 out of 10 people feel a lot better. But if you took an x-ray, re-x-ray in 1 month's time, nobody would be correct. It's just not enough time to change the spine, right? And so the problem would still be there underneath it all, but the pain would be gone. And most of us, we don't think like that. We just think, okay, if I got pain, I have a problem. If I don't have any pain, then my problem's gone. But that's not true, okay? So we're gonna have a quick course in anatomy, and we're gonna go back to like probably 10th grade, 8th to 10th grade. We learned this in school, that the spine from the front is straight, right? Everybody got that? And from the side, like this is someone looking this way, the spine actually has curves in it by design, right? So when you're in these positions from the front and side view, that's where we need to be as healthy as possible. And health has nothing to do with how we feel. Health has more to do with how are the nerves going to all the different organs and tissues and glands and cells in the body, okay? Every part of the body gets a nerve supply from the brain down the spinal cord out to wherever the nerve goes to. And the more that those nerves flow, the closer we are to optimal health, okay? So when you look at this picture here, this is actually a picture of someone looking this way, the brain, right, in pink, and the brain becomes the brain stem, and then the spinal cord in between the vertebrae, right? The vertebrae are created to surround and protect the spinal cord, right? So the brain sends messages down to the spinal cord and all different parts of the body. Now, this is good, we don't have any children here, this is not PG. This is an actual dissection by a medical doctor in Switzerland. This is actually someone looking this way, and if you cut through the side of them, you would see here's that brain stem, and the brain stem becomes the spinal cord. You see how that's curved? Remember I told you the neck has a curve like that? This would be a cross section. If you cut the head off and you look straight down, the outside of this is the vertebrae and the inside is actually your spinal cord. You see that? This person's neck is different than this, right? What would you say this one is compared to this one?
Straight.
Straight, right? And you know what that's called?
A problem.
Yeah.
A problem.
It's called pain in the neck, right? It's whiplash. This is whiplash. When you get in a car accident, you lose that curve, okay? Now look at the cross section here versus this one here. Sorry, I keep taking this to the camera so I can see that. But do you see the difference? What do you see?
Compressed.
It's compressed, right? And so now the brain's trying to send electric and chemical signals down to the rest of the body, but it's not getting there as well. You remember Christopher Reeve, Superman? You remember he had a horseback injury and he fractured his second bone in his neck. They call it C2. The bone fragment was touching the spinal cord, and his brain was working as good as everybody else's brain here, but it couldn't breathe on his own or walk on his own because the messages were being blocked off. And nobody here has that, right? Thank God. But what you have, if you have that whiplash, or if your x-ray showed that, you have the potential to have pressure upon your spinal cord or stretching upon your spinal cord. You ever seen those Chinese finger things that you put your fingers in there and you pull it apart like that, it tightens down? Well, that's what this picture is showing you, that the spinal cord has tension upon it. Okay? So this picture just shows the nerves coming out of the spinal cord, go to all the organs, muscles, glands, cells, and tissues in the body. This one's actually the organs here. See that? One nerve goes to the heart, the lungs, the stomach, the kidneys, the liver, the reproductive organs. Every area gets a nerve supply. And it's funny that the way the body's made, it's kind of like You know those electric breaker boxes in your house, and one switch will go to the kitchen, and the next one will switch off and go to the living room or the bathroom? Well, the body is designed that way, like certain parts, the nerve, the bone that's surrounding that area, when it's out of position, it'll cause symptoms in different parts of the body. This chart's pretty interesting. If you want a picture of this when you're done, just ask Sarah and she'll make a copy of this. But let me just read the first one, the top bone. Remember, Christian Reeves had C2. C1 means cervical or first neck bone. Look at what this can cause. Just listen for a second. So C1 can cause spaciness, dizziness, low energy, memory trouble, brain fog, ADD, earaches, ringing in the ears, nosebleeds, sinus problems, snoring, sleep disorders, sore throats, colds, flus, itchy, achy eyes, allergies, and food sensitivities. Now, raise your hand if you know someone that has something like that, right? Now, not everybody that has, say, allergies is misaligned in that area, right? Because many other things could cause that. But how many of those people should get checked? All of them, right? We have a philosophy in our office, right? If someone has a symptom or complaint and they come to our office and we x-ray them and they happen to have the bone in that area affecting that nerve, then they're in the right place most likely, right? But if they don't have a problem with their spine in that area, then we're not the right office for them. And we'll help them find maybe a different type of office that might be better suited for them. But when you're telling someone to come here, always let them know, hey, they'll x-ray you, and if you have a problem in that area, they'll make a treatment plan and see if we can take a re-x-ray in 90 days and see if we can help that get to a better position or not. But if you don't have a problem, they're real honest with you. They'll say, hey, look, your problem doesn't fit this office. Does that make sense?
Mm-hmm.
So I wanted to show you this here. This is an actual chart of a nerve, right? So what percentage of your nerves do you think perceive pain? What would you guess? Do you think like all the nerves feel pain or some of them feel pain?
Oh, 30%.
Very good. 10 to 20%. Very good. What chiropractic college did you go to?
I'm just a nerd.
You're just a nerd. But you ever seen, I'm the nerd too, right? You ever seen, like on television, they'll have someone, they'll cut their skull and they'll touch different parts of the brain. Like, what do you feel? Oh, I feel this. I feel, happy, or I feel sad, or I feel hungry, or just, and then, but not every place they press felt pain. Isn't that true? He's validating what I'm saying. You guys ever hear about that? I mean, it's just amazing. You think, well, not all of the nervous system. The nervous system is the brain and the spinal cord and nerves. Not all of it's pain. So if it's 10 to 20% of your nerves, and you walk in and say, hey, doc, I feel great. You're a miracle worker. What do you got, magic fingers? I think I'm done with care. But you only had 2 visits, like, no, I'm done, right? Well, you just told me about 10 to 20% of your nervous system, right? The other nerves go to your muscles, and then this one goes to the organs. And they call that the automatic nervous system, right? Autonomic nervous system. That one you don't have to think about, right? Because think about this. What if you had to tell your brain to send a message down to your heart 60, 70 times per minute, and then you went to sleep at night? What happened?
You don't wake up.
You'd wake up, but you wake up like in a panic. Oh, I forgot to beat, right? Or what if something was like food going through your intestines, right? You're like, oh, wow, that feels weird, right? Like certain parts don't have pain-sensitive nerves in the body, right? That's how someone could have a pinched nerve that goes, say, to their liver and not even know it till it's really bad, right? So you hear me talking about the spine and relating it to organs. If you know someone has problems with their health or organs, it's really good to have them checked by a chiropractor. I'll tell you a true story. I had this guy come in, he's a school teacher. He had a prostate issue. So I said, did anybody check your spine? He goes, no. So I x-rayed him, and he had a problem in his back that could affect the nerves to his prostate. And he got adjusted, and he got better. And he said, oh my God, I wish I would have come to you before they did all these like tests and tubes and things that were like really, humbling, right? And so I was like, that's so weird that in society we know about this nerve chart in like 8th to 10th grade, but then when we get older, we forget that part. And so when I ask people, what did you learn most from the class? What did it remind you of? What did it, pique your memory about? Most people say, I had no idea that the nervous system and the spine surrounding it could affect my organs or my health. Like the sciatic nerve, right? I was telling these guys today, you guys ever heard of sciatica? Mm-hmm. What does that mean to you? Pain where?
Down your leg.
On your leg, right? Pain on this thing. You're pointing at him like he had it or something? Oh, you're pointing at his leg, yeah. Okay, so everybody knows that the sciatic nerve controls down the leg, right? And I told them that the more it pinches in the back, the further down your leg it goes. So if you have numbness in your toes, you have a lot of pressure, right? But have you ever known a doctor to say, do you have bowel or bladder incontinence from your sciatica? Have you ever heard that? Okay, if you have that, that's like go right to the emergency room because that's very severe, right? That you can't control your bowel or bladder, right? But many people have digestive issues, not incontinence, but they have digestion, diarrhea, gas, bloating, things like that. Reproductive problems like menstrual problems or fertility problems or erectile dysfunction, prostate issues, and the urinary tract, like frequent urination, things like that. A lot of people with sciatica have frequent urination, kidney infections, things like that, urinary tract infections. Those are 3 branches that come off the sciatic nerve that people don't realize. Okay, so I don't usually talk about that, but that little tip, if you know someone has incontinence, they have sciatica, get them to ER. Okay, but hopefully when they just get like a little buttock pain or something like that, like that's least pinch. Then if it goes like below the knee, that's worse. And hopefully if you get them to a chiropractor sooner, then you could, get a better chance of fighting that back and avoiding surgery. Okay, so I wanted to share this picture with you here. This is a picture of someone looking this way through their lower back. And you can see, I don't know if you can see, but you see the front of the vertebra here? Do you see this one is behind the other ones? That's good. You guys, do you see it? Do you see it? This one here. It's misaligned. In chiropractic, we call that subluxated. It's not in the right position, and it puts pressure on the nerve. These are the nerves that come out here. Can you see that this nerve, I'll show the camera real quick, is smaller than this nerve? Do you guys see that? So that's, when you have a subluxation, that's pressure upon the nerve, okay? And that's what chiropractors detect and treat, okay? But there's phases to chiropractic care, like I was telling you earlier. The first phase is what we call the relief phase, right? And that usually takes about a month, and the patient's in pain, they do their exercises, they get adjusted, then they're out of pain right here. Now at this point, most people want a quick care. Like I told you, they feel good, they think the problem's fixed, and then the problem's still there, and then the problem worsens, the pain comes back. And then you have to start all over and try to get this thing corrected. But the best way to do this is go the first month through the pain phase, then start the correction phase, and then go through the strengthening phase. At the end of 3 months, we take the picture over again on the x-ray. Then you'll have a choice to go to what we call maintenance care or wellness care. Most people come in, they get adjusted like twice a month or once a month. Like me and my staff and my family, we all get checked once a week. My kids, I have 5 kids. Every week I would check them, and every week 4 out of the 5 would need adjusting and 1 wouldn't, right? And it just depended on what their week was like. Were they on the trampoline? Did they go skiing? Or they had football or wrestling? Did they fall off their bike? Did they jump off their bed? What did they do in between? Like all those things cause misalignments or subluxations, okay? So the way that we correct that in the office is we use chiropractic care, we use exercises in the office and at home. I'm going to show you the home exercise here, and we use traction in the office and at home, okay? So the three of those together make the best correction. Now, I've been doing this a long time, and I can tell you, I had patients. One guy's name's Chris. He's a trainer. He came in and he's like, well, I'm a trainer, and I want to correct this just with exercise. So I was like, great. Let's do that at home. It'll be a great experience. You do the exercise. 3 months later, we'll come back and re-x-ray you. He only had like a 50% correction, right? And then most people say, well, I'll just do the adjusting. And then without the traction exercise in the office at home, when you go to re-x-ray them, they're like 50% corrected. So 50%, the moral of the story is the correction comes from you bringing your body here and keeping your visits. The other 50% comes from you doing the home care, okay? So I'm going to show you the home care now. So this is the first exercise. We call it dead bug, okay? So you're lying on your back and you're lifting your opposite arm, your opposite leg, and your head. You hold it for 2 seconds and then you let it down. And then you do the other side, the left arm, the right leg, and your head. The most important thing with this is when you're lifting, you're tightening your core. You know how to tighten your core if I told you to? Usually I tell people, if I told you I was going to punch in the belly, right, punch in the stomach, you tighten up. That's the feeling you want to have, and you want to lift your head, especially if you got the whiplash, okay? So you're going to do that, both of these exercises you're going to do in sets of 10, which is really 5 on each side. You're going to do 5 or 6 sets of 10, but everybody's going to start out with 10. There's always one guy that could do more, like this guy probably, is going to do, you want to get to 50 or 60, okay? But just start out with 10 or 20, whatever you think you could do. Everybody, to me, the number doesn't matter. What matters is that every week you add on, you improve. Does that make sense? Okay. And then the other one's called Superman or Superwoman. It's the same thing, but on your belly. You're going to go opposite leg, opposite arm, and your head. And that head going back is what's going to get those muscles to pull the head back. You know, a lot of people have this forward head posture these days. What's the number one cause of forward head posture?
Computer.
You guys are smart. Most people say car accidents, right? But car accidents are very rare, you know? It's the day in and day out. Reading, texting, laptops, computers. It's like epidemic right now. Okay? Yeah. Everybody. I've seen people walking. They don't even know where they're walking. They must walk into somebody, you know, they're just so much on their phone, yeah. So that's a whole nother story. But when you're done with these exercises, you're going to do what we call spinal molding, okay? The boxes that they come in have 2 in there, okay? So one is more round and one is skinnier, right? You see, can everybody see that? So the bigger one goes in your back and the smaller one goes in your neck. So you put it above your belt and above your collar. So say that with me, belt and collar, so you remember it, right? And it's good that you have your spouses here so you can teach each other, remind each other. And you lie on it for, see how she has her knees bent here in this picture? And you see the wedges in there? So you lie on that for 20 minutes, once to twice a day, and you set a timer so that you don't fall asleep on there and wake up 3 hours later and wake up sore. Once you can do 20 minutes, some people even like to sleep with them in that position or start out with it and take it out at night. But the more you do this, the merrier. It's like braces on a kid's teeth, right? You don't hit the tooth with a hammer and knock it back in one day. You tighten the braces up every visit, and that pressure over time is what moves the ligaments and the muscles of the tooth back. In physics, that's called creep deformation. Helps things mold back, right? That's how braces work, and that's how these things work here. We don't have braces for the spine, so we got to do this the old-fashioned way. Does that make sense? Okay. Hi everyone, it's Dr. Casabona. I just want to say thank you so much for clicking the link or watching us on YouTube. I want you to know that we're here for you. If you have any questions, please feel free to call me at the office, 520-498-9984, and I'm always here to answer any questions you might have. Thanks again. Bye.